Here's a question I get asked more often than you might think, and it usually comes with a lot of embarrassment and whispered concerns. Dr. Julia, does testicle size really matter for testosterone, fertility, and performance in bed? I'm Dr. Julia, and today we're going to tackle one of the most misunderstood aspects of male anatomy with pure science, not myths or locker room comparisons. You're probably wondering about this because you've looked in the mirror, maybe compared yourself to others, or heard conflicting information that's left you confused and worried. The truth is going to surprise you, because bigger definitely doesn't always mean better, and what you think you know about testicle size and male health is probably completely wrong. I'm going to break down exactly what your testicle size actually means for your testosterone levels, your fertility potential, and your sexual performance, using real medical evidence that will put your mind at ease and give you the facts you need to understand your own body. Let me start by explaining exactly what your testicles are doing inside your body, because understanding their function will completely change how you think about size and what it actually indicates about your health. Your testicles have two main jobs, and I want you to think of each one as a sophisticated factory with two completely different assembly lines running simultaneously. One assembly line is dedicated entirely to sperm production. That's your fertility factory, working around the clock to create millions of sperm cells. The other assembly line produces testosterone, the hormone that powers your energy, builds your muscle, drives your sex drive, supports your mood, and maintains so many aspects of what makes you feel like yourself. Now here's the crucial detail that changes everything about what size really tells us. Approximately 95% of your testicles' volume is dedicated to sperm production, while the testosterone-producing cells only take up about 5% of the total space. This means that testicle size is primarily telling you about sperm production capacity, not hormone production capability. Let's dive deep into fertility first, because this is where testicle size actually does matter in a meaningful way that can impact your life. If your testicles are larger than average, it usually means you have more internal machinery specifically dedicated to creating sperm. We're talking about more seminiferous tubules, which are the tiny coiled tubes where sperm is created, developed, and matured over a 74-day cycle. Think of it like this. A bigger factory typically has more conveyor belts, and more conveyor belts generally mean higher production output. So yes, larger testicles generally do have a higher sperm-producing capacity, which translates to better fertility potential. This is exactly why testicle size is one of the first things we evaluate clinically when men come to see me with fertility concerns, or when couples are having trouble conceiving. If your testicles are unusually small, it could indicate fewer or less active sperm-producing structures, which might affect your ability to father children. Now I'm going to completely bust the biggest myth that's probably been causing you unnecessary worry. Bigger testicles do absolutely not mean higher testosterone levels. Let me explain exactly why this misconception is so widespread and why it's completely wrong. Testosterone is produced by a completely different set of cells called Leydig cells, which live in the spaces between the sperm-producing tubules. These Leydig cells are relatively small, and they only make up about 5% of your testicle's total mass. This means that even a very large testicle might have surprisingly few Leydig cells, or the ones it has might not be functioning efficiently. On the flip side, a smaller testicle could have a small but highly efficient population of Leydig cells that function like absolute powerhouses, producing perfectly normal or even high testosterone levels. The number and efficiency of these Leydig cells has virtually no relationship to overall testicle size, which means testicle size is actually a terrible predictor of testosterone levels. If you're starting to realize that everything you thought you knew about testicle size and male health was probably wrong, and you're finding this scientific breakdown helpful, I want you to type the word power in the comments below. This helps me know that you're engaged with this content and that you want me to continue sharing these myth-busting, science-based insights that can transform how you understand your own body. So if you're trying to understand your actual testosterone levels, I want you to stop staring in the mirror and start paying attention to what your body is actually telling you through real symptoms and signals. The genuine signs of hormonal balance or imbalance have nothing to do with what you see when you look down. They're about how you feel, how you perform, and how your body functions day to day. Is your sex drive lower than it used to be, or do you find yourself less interested in intimacy than you once were? Are your erections weaker, less reliable, or taking longer to achieve than they did in the past? Do you feel like your energy levels have dropped, leaving you tired even after a full night's sleep? Has your mood shifted? Are you more irritable, anxious, or experiencing low-level depression? Are you losing muscle mass despite maintaining your exercise routine, or are you gaining belly fat even though your diet hasn't changed significantly? These are the true signals of hormonal imbalance, and they provide far more accurate information about your testosterone status than any physical measurement ever could. If several of these symptoms sound familiar to your current experience, the next step isn't guessing or comparing yourself to others. It's getting a comprehensive hormone panel blood test that measures not just your total testosterone, but also your free testosterone, estradiol, LH, FSH, and other key markers that give you the complete picture of your hormonal health. However, I do want you to understand when testicle size changes actually are medically significant and worth discussing with your healthcare provider. If you've noticed that your testicles seem smaller than they used to be, especially if this change is happening alongside fertility issues, unexplained fatigue, or other hormonal symptoms, that combination of factors definitely matters and deserves medical evaluation. Testicular atrophy, the medical term for testicle shrinkage, can be caused by various factors including varicoceles, infections, hormonal imbalances, certain medications, or other underlying conditions that benefit from early diagnosis and treatment. A comprehensive evaluation would typically include a detailed medical history, physical examination, semen analysis if fertility is a concern, hormone testing, and possibly imaging studies to identify any correctable causes. But if your main concern is about testosterone levels or sexual performance, don't rely on size comparisons or mirror examinations. Let me address the elephant in the room that many men are really worried about when they ask about testicle size: sexual performance and confidence in bed. The reality is that testicle size has virtually no direct impact on your ability to achieve and maintain erections, your stamina, your pleasure, or your partner's satisfaction. Sexual performance depends on factors like cardiovascular health, blood flow, nerve function, hormone balance, which we've established is unrelated to testicle size, psychological well-being, stress levels, relationship dynamics, and overall physical fitness. If you're experiencing concerns about erectile function, premature ejaculation, reduced libido, or other performance issues, these problems require targeted evaluation and treatment that focuses on the actual underlying causes, not speculation based on anatomy. Effective treatment might involve addressing cardiovascular risk factors, optimizing hormone levels through proper testing and treatment, managing stress and anxiety, improving communication with your partner. When we talk about natural approaches to supporting male sexual health, the focus should always be on interventions that target the actual physiological processes involved in sexual function. This includes optimizing blood flow through cardiovascular exercise and heart-healthy nutrition, supporting healthy hormone production through adequate sleep, stress management, and proper nutrition, maintaining a healthy weight to reduce inflammation and support hormone balance, addressing any underlying health conditions like diabetes or high blood pressure that can affect sexual function, and developing the mind-body awareness and techniques that enhance sexual control and satisfaction. These evidence-based approaches work because they address root causes rather than focusing on irrelevant anatomical characteristics. If you're concerned about sexual performance, the most effective strategy is working with healthcare providers who specialize in sexual medicine and can provide personalized evaluation and treatment recommendations based on your specific situation and needs. And testosterone levels. There's essentially no reliable connection. Hormonal function completely beats anatomical size every single time. If you're worried about your testosterone levels, focus on recognizing genuine symptoms like changes in energy, mood, libido, body composition, and sexual function. Then confirm your suspicions with proper blood testing, rather than mirror examinations. If you're concerned about sexual performance or erectile function, address the actual underlying causes through comprehensive evaluation and evidence-based treatment approaches, not through anatomical speculation. Most importantly, resist the urge to self-diagnose based on myths.